Joining me now here in our visual radio studio, Sandra Grunwaldt is here. She is the F.E.T. and Diabetes Education Manager with San Juan Regional Medical Center. Good morning. Thanks for being here.
Good morning, Scott. Thank you for having me.
You bet. It's great to have you here to talk about all the hats that you wear at San Juan Regional Medical Center. And this being November, it is Diabetes Awareness Month, correct?
Exactly. And that's why we're here to talk to people about how they can be more aware of factors that may put them at greater risk for getting diabetes at some point in their life, and also helping those with some tips that may have already been diagnosed.
Okay, and diabetes is something we always hear about, that it kind of sneaks up on people, and that they may be suffering from kind of pre-diabetes and in that risk category, and people don't always realize that in time to maybe take steps to reverse it or avoid diabetes, right?
Exactly. Very well said. Diabetes is one of those chronic conditions that really does not have any noticeable symptoms. It's really up to you to work with your doctor to get those labs and get those blood tests, a glucose test, A1C, and that will tell you where you are at and
Right.
what steps you might need to take once you do that. So that's step number one. Definitely work on that relationship with your doc. Make sure you're getting those labs done at least once a year.
Right.
And
are some age groups more at risk than others, or are we seeing diabetes more in younger and younger people?
can I say yes and yes?
I'm afraid you probably can.
That is one risk factor that no one is able to figure out yet. But yes, if you are 45 or over,
Okay.
you are at higher risk for getting diabetes at some point in your life. But according to the American Diabetes Association, we as a nation are seeing more and more children with specifically type 2, which actually affects 90 to 95% of all people. The type 1 is only about 5 to 10%. So
I see.
our conversation today is probably focused more around that 90 to 95% of people.
That type 2.
Yes,
right?
exactly.
And that is the type of diabetes, too, that can be sometimes reversed to a certain degree. I know
Well-
there's not really a cure, or am I wrong?
Why don't we say you're on the right track?
Okay.
The
Set me straight.
Yes, I'd love to.
Right. Right.
That is why I'm grateful to be here today to help pass on this message.
Right.
Some
Because I'm
really-
sure if I think that, other people do too. So that's why it's important to get the right information out there.
Exactly. That's why we appreciate you so much. One of the wonderful things, if we can look at it in a positive light,
Yeah.
they say about 1/3 of all adults, 1 out of 3 adults are at significant risk for diabetes, or what the profession calls pre-diabetes.
Okay.
One good thought about that, while it's scary and it's prevalent and it's some say a tidal wave coming our way, there is enough evidence to prove that we have ability to prevent or delay diabetes
Okay.
by practicing some behaviors.
Gotcha.
And we'll talk about those.
We will. We
Yes.
will. But if someone is diagnosed as pre-diabetes, it doesn't mean that it means that they're at risk of developing full diabetes, but it doesn't mean that that's inevitable, that there
Exactly.
are steps they can take.
And that's the great news. And so we have the correct and correct information. We say that pre-diabetes, or the CDC, the Centers for Disease Control, signifies or says you have pre-diabetes if your A1C is between 5.7 and 6.4. And then that is why it's so critical that you work with your doctor to get those tests and get those numbers, and then work on a plan if you know you are at high risk.
Right. And that's what the doctor can help you to develop that plan to get that number back out of that range.
Exactly. And another way is we are very fortunate here. San Juan Regional Medical Center does offer the Lifestyle Balance Program, which is the National Diabetes Prevention Program. It's rebranded to a easier to remember name.
Right.
But that program has been proven nationally to prevent or delay the onset of diabetes. It is a free class that is actually 10 months long, Scott. So we're a little early here, but it's quite a commitment. And that starts in February. But we've got a wonderful team of nurses, case managers, registered dietitians, certified personal trainers that will work with people to support you with your challenge, to educate you with what you need to know so you can get on a healthier path and hopefully prevent that.
Sure. Well, excuse me, but February is just a few months away. It's not very long away. It's going to be here before we know it.
Exactly, especially when you factor Thanksgiving and Christmas and New Year's.
Yeah, here we are.
How busy we are, and
Right.
sometimes how off track we all get with those big meals and the potlucks and the treats at work and the gifts. It's going to be here before we know it. So that's why I'm grateful to you to let us share the word that this is an opportunity for anyone in our community. It's open to our employees, but we also have it available to anyone in our community that is knowing that they're at high risk, or they think they are at high risk, either because they are over 45.
Right.
They may struggle with weight a little bit. They may have that A1C that is between 5.7 and 6.4. Or they may have given birth to a baby that's over 9 pounds. That's another risk factor we have.
Interesting.
And the other risk factor I would say is one of the most prevalent is being physically active less than 3 times a week. And look at what we're doing right now. What are
Right.
a lot of us paid to do all day?
Sitting and talking.
Yes,
Right.
sitting and talking and meetings and reports and computers and phones and a lot of sedentary time during our days.
True.
So working on those things can definitely help.
Good advice. And so this program, if someone wants to sign up or get more information, what do they need to do?
I'll give them 2 options. One, they can call 609-2171.
Okay.
And we'll work with them and their primary care physician to make sure we get a referral and we'll get them on track.
Gotcha.
The other option is to visit the San Juan Regional Medical Center website. We've got enormous amounts of information on there
Sure.
also, so whatever is most convenient.
Okay. And that's sanjuanregional.com, if I'm not mistaken.
You are exactly correct.
Okay. And this is a free program, or is there a cost involved to be part of this?
We are very grateful as a community-owned hospital to offer this program, the Lifestyle Balance or Diabetes Prevention Program, as well as the diabetes education classes and one-on-one appointments for people that are diagnosed for absolutely no charge.
Wow. Okay.
We are very fortunate. There are several communities that surround us that do not have this option, and we're very, very fortunate to work with many of the providers in our community that know we're here. We're there to help educate, help inspire, help support people that want to either prevent or manage the diabetes they've been diagnosed with.
Very good. And the next class you mentioned starts in February.
Correct, for the prevention.
Okay. And so if I think maybe I may be at risk or I'm not sure, it would behoove me, I guess, to make an appointment and get a blood test done and find out for sure if I'm
Exactly.
in that
And-
range or not, and then I can still sign up for the class if I am.
Exactly, exactly.
And I imagine it's not necessarily, I mean, you've got to have a limit at some point, right? There's a limited number of spots for people in those classes, right?
Exactly. So that's why we're working early to get people all set and signed up. So we do try to limit it to about 15, 17 people.
Okay.
Because it's a very personal opportunity. In other words, we work very closely with you and what are your challenges and how can we help you with those challenges. So it's if we get the class to be too large, we lose that personal contact and that coaching aspect that's so very valuable.
Right. And you mentioned this is a nationwide
It
proven
is.
success story, right?
It
By people
definitely
going
is.
through this class.
This program is actually offered throughout the country and in most communities. Actually, the YMCA, I believe, is the first to start it.
Okay.
So we're one of, I don't know how many thousands, I don't want to quote numbers, but we are grateful to have that here because of the enormity of the risk factors and number of people that are at high risk for it.
Right. And remind us again the time commitment, because it's a multi-week class.
It is. It actually begins in February and it goes for 10 months. The first 16 weeks are just 1 hour a week.
Okay.
On Thursday morning. So we provide a nice breakfast for you and you get to know your team and you've got a built-in support system that way and you work with the professionals to really keep you on track. And it really is a life-changing opportunity because if you truly can prevent or delay, it only enhances your quality of life and allows you to do the things you love and want to do.
Gotcha. So that's the first 8 weeks. What about the rest of it?
That's 16.
Oh, pardon me. Yeah.
And then we taper off about every other week for
Okay.
the next several months because you're becoming more knowledgeable, you're becoming more active, you're making better choices, and that support isn't as intensely needed. In other words, we want you to be successful, and how do you manage these things as you head out?
Gotcha. And so these are maybe some new habits, some new lifestyle
yes.
choices to get used to and familiar with. So
Definitely.
hopefully after 16 weeks, you've kind of got it ingrained a little bit better than...
That is the goal. And once you develop these habits, they become a part of you. And you don't
Right.
feel right if you don't do them. So trying to change those habits is why we meet so frequently in the beginning.
Very good.
Yes.
Now, you mentioned that some of this is age-related, some of it is blood test-related, and
Yes.
and weight as well.
Weight
What-
is an issue.
How do we know if we're just at
Yes.
risk or just have a few extra pounds? It is the holiday season. Maybe we'll get rid of it in February or January, we hope, or
Yes.
what would you say?
I would say if you have even one of those risk factors, overweight, if
Right.
your doctor has mentioned that, if you are 45 or older, if you have a close relative that's had diabetes, if you have had a child over 9 pounds, if you're not physically active, if you have one, definitely two of those risk factors, I would say definitely give us a call.
Okay.
It's worth your time, it's worth your effort, it's your quality of life. So we definitely encourage the call.
Right. And let me ask you a little bit. I know you're not a medical doctor, but I
No,
mean, if
no.
someone does, develop diabetes, it is somewhat life-changing, right? I mean, there
Definitely.
are certain things and other things that can, other organs that it can harm or things like that in your health, correct?
Exactly. And thank you for that segue, too, because I should remind your audience, I'm not a clinician. I am the manager of our diabetes education program and our
Right.
F.E.T program. I am
But you certainly
here-
know what you're talking about.
I definitely do. Thanks
Yes.
to a wonderful, wonderful team of very bright and caring team educators and nurses and registered dietitians. I am here to help people become aware of all of this wonderful support and get them to come to see the educators so they can truly live a better life. So,
Sure. And not to scare people though, but I do want to
no.
mention about what diabetes does to the body, and if you have an opportunity to delay it, reduce it, reverse it,
Yes.
why not take advantage of it?
Exactly. And that's the benefit of the diabetes education program.
Right.
Or the classes and one-on-one appointments we have for people that already have been diagnosed. Because you're right, diabetes is a progressive lifetime disease. But if you learn how and understand the importance of managing those blood sugars, you can feel better, you can have more energy, you can do the things you love for longer and prevent, even delay complications by managing those blood sugars. And we've got some tips on how do you best manage that diabetes if you do have it.
Aha. Okay, I'll ask you about that in just a minute.
Okay.
But that is something that we're talking about. Sandy Grunwaldt is my guest this morning. She is the Diabetes Education Manager at San Juan Regional Medical Center. She is also part of the Full Engagement Training Program at San Juan Regional Medical Center, or F.E.T, that you may have heard about. We're going to talk about that, too, in just a bit this morning as well.
Yes.
But with this diabetes problem that people have, and again, we see more and more of it, it seems.
How about a challenge?
How about a challenge?
Not a problem.
Problem.
Challenges
Diabetes
you can
challenge.
address. Yes.
I like it. Okay.
Yes.
Thank you. So with this challenge that we see more and more people having to do,
Yeah.
what can we do? Be more aware of it, I guess, is the one thing. These warning signs that you've
Definitely.
told us about.
Yes.
Taking advantage of these programs that you are telling us about this morning, the next one starting up in February.
Exactly.
And just to be in a lifestyle situation. We always hear about, eating less, moving more. I mean, it's almost as simple as that, but I know it's a little more complicated. But
A little bit more, but
as we're sitting here talking and not moving more,
Yes.
there are things we can do in our everyday life, parking further away from the
Definitely.
mall, parking further away from work, and walking
Yes.
across the parking lot, walking up the stairs, not taking the elevator. Some of these simple things, right?
definitely. And that's why we say we've got 4 top ways
Okay.
for most people to manage their diabetes. Now, we always say, of course, assuming you're working with your physician
That's
on,
important.
if there
Sure.
are medications or complications or other challenges involved. But
Right.
the top 4 ways we like to share to manage your diabetes if you have been diagnosed is to say be aware of and educated about your diet and nutrition. And that's in a couple of different ways. It's not just what you eat, Scott.
Right.
But it's how much you eat, when you eat, and what you eat. So it's kind of that full gamut of just being more aware of what are you eating, when are you eating, why are you eating. Is it
Okay.
for emotional reasons? Is it to balance the blood sugars? And so becoming more educated and knowledgeable about food and nutrition is a significant benefit to people that come and visit with the educators, because that alone can really influence those blood sugars.
Interesting. It seems like in this country we have a big issue with portions and portion control, right? We serve a lot. We have supersize, we have extra large meals and things like that maybe aren't the wisest choice if you're trying to watch what you eat and how much you eat.
But people know that you like value, and if you're going to get a lot for your money, that's a tendency for us to be more attracted to those places to go.
Sure.
But there's no reason you couldn't get a to-go box and finish some later, or being aware of what is in what you're eating and making better choices maybe when you go out.
Sure.
Or when you go to grandma's this coming weekend.
We have tomorrow Thanksgiving, and so I think folks are always thinking about, watching what they eat, and the holiday season, of course, there's a lot of temptations to indulge in holiday parties and things like that, and so this is something that you're talking about, right?
Definitely, and again, working with a professional or a clinician can give you even more information regarding carb counting and how do you go about that, but just for today's program, simplicity, working with someone having that knowledge, but just trying to incorporate those vegetables at every meal, some type of vegetable at every meal is a very wonderful, easy place to start. And we also refer to Healthy Eating 1, 2, 3 as a great place for people to begin. Also is really doing your best to avoid those liquid sugars, what we call soda and juice and those type of things. They're quick to hit your bloodstream. They're quick to raise those blood sugars. So we try to avoid those as much as you possibly can, and also try to eat 3 meals a day. A lot of us will think, if I skip breakfast and lunch, I can just enjoy my Thanksgiving meal even more. But if you have diabetes or you're at risk for, some of the training the educators provide is, what is that doing to your body when we go that long without eating?
Right. I would think that would mess up levels and things like that.
Makes things more challenging.
More challenging.
Keep it at
there you
that.
are. I like it. What are some of the other things that we can be watching for? You said there's a list of 4.
4. So we talk a lot about food and nutrition, of course. But the other, thank you for starting, is, and notice I'm not going to say the E word. I'm not going to say exercise. I'm going to say physical activity.
Okay.
In other words, how can you get more movement in your day? Even sitting in this chair. I know we're on camera, so I'll behave, but I'm a wiggler.
What can we do? Right.
You can do ab exercises, and we do some things in the classes. We've got the bands, the resistance bands. You can do things with the chair, with the floor, with the wall that will allow you to move more no matter what situation you're in.
Even sitting in a desk, there are things that you can do.
Yes, even driving, can I say.
Wow.
There are little things safely you can do in order to prevent those hours and hours of sedentary time that a lot of us, especially if we're very focused and we're on that computer and we're getting things done, how are you going to get that movement in your day? So look at ways you can move. We say come to a class, of course, because we can teach you and show you different ways.
Right.
And then what are things you can do more around the house that you can say, I may not love to go on a walk or a run when it's snowing tomorrow, but what can I do in my house that is just as valuable, Scott? So getting that movement is really, really key.
And I imagine, too, again, for folks of all ages, because some of us may not be as active as others.
Exactly.
And so there are things that are easier for a senior to do sitting down.
Definitely.
When they're maybe home watching television or listening to the radio, ideally, everybody.
Yes.
But that they can do to maybe at least, get more calories burning and more physical activity.
Exactly. And that's another great reason I encourage people to come to Lifestyle Balance, come to Diabetes Education, come to F.E.T. We've got professionals that can teach you how to do things safely no matter what you are working with, whether it's an injury or if it's, things that you just have never been experienced with or exposed to show you how you can connect being more active to doing the things you really, really love and care about for years to come.
Very important.
Yes.
A couple more tips?
Certainly. The other is also a significant challenge for many, especially this time of year. I don't know if most people are aware, but high stress also affects your blood sugars, which that's the highest challenge or greatest challenge for people with diabetes is managing those blood sugars. So if you're in a constant state of stress, whether it's because of work or relationships or the meal you have to cook or family issues, or maybe it's all the above, I don't think a lot of people realize that alone can significantly help those blood sugars if you have diabetes. So working on ways to lower your stress, and it's very personal, Scott, isn't it?
Right, yeah.
It really is.
Sure.
I can go on a walk or a run, and I feel like I can conquer the world. Other people may need to pray. They may need to just have some more personal time, get away from what it is. And that, we say, is one of the most significant benefits of recovery. Do you practice recovery in your day? And we say, do you get a break?
Right.
At all.
And many folks may not get that break till they go to sleep.
Right, especially if they're going home to children and
Other
housework and homework
responsibilities.
and
Yeah.
soccer practice, and you don't get enough rest. It's a cycle that's not helpful to anyone, but even more so to people that are managing their diabetes.
Sure. And that's what these programs, I would think, help teach us about ourselves, right?
Yes,
Because you take a
yes.
look at the individual schedule and their commitments and things like that and try to
Exactly.
remind them what they're
Yes.
expecting of themselves. It may or may
Right.
not be reasonable.
And that's a great tip too, is to say, you've got probably this big list right now. You've got, your grocery shopping and your cooking and your gifts and your baking and your parties and all these things coming, especially this next 6 weeks, so heavily. Could you maybe tonight think about doing, or today, a to-don't list? In other words, what could come off of that massive list of things that you think you have to do, that you're putting all that pressure on yourself to not only get accomplished, but also really well and with a smile?
Right. Right.
What could go off that list? What could you maybe get some help with? Is there someone that you could get some support from? And remember, it has this ultimate positive effect. If you can lower those stress levels even just a little bit, that can help manage your blood sugars, which ultimately helps you manage your diabetes, helping you prevent those more serious complications. So, stress, physical activity, and nutrition. Some big topics, but we've got great people to help you with that.
Good to know.
One more.
What is it?
One more, which we're not
Okay.
going to talk a whole lot about because
Okay.
it's a pretty enormous topic, and it's the medications world.
Right.
And they run the full gamut, and there are so many options right now for people with diabetes. The technology is just moving so rapidly, which is actually wonderful for people because their options continue to grow.
Sure.
And things that are less invasive, that are less challenging, that are less painful,
Right.
are continuing to come out.
But important, maybe if you have a family history of diabetes, you remember maybe what mom or dad or grandma
Yes.
or grandpa went through, that the medications and the treatment plans are maybe much different
Oh
today.
my gosh, so much more user friendly. And we do have a couple of nurses that work in our diabetes education department, and they say, how grateful they are to be helping people now,
Right.
because there are so many better options for people, and that's part of our world. Things keep getting better and more efficient, and in the diabetes world, that is certainly the case. So those 4 things, if you can work with someone to get the medications exactly where you need them to be to better manage those sugars, more physical activity, really understanding your nutrition, what you're eating, when, why, and how much,
Right.
and that stress, get that, working on that.
Your to-don't list. I like that.
Yes.
Exactly. And the medications part of it. Very
Yes.
good. Sandy Grunwaldt is my guest this morning. We're going to take a short break.
Okay.
When we come back, more with my guest in just a moment. We'll be talking more about diabetes education. It is National Diabetes Awareness Month, and also F.E.T, full engagement training at San Juan Regional Medical Center. So back with my guest with more in just a moment here on KSJE. Wednesday morning here on KSJE. You're listening to the Scott Michlin Morning Program. A special good morning to our viewers who are watching us on the KSJE Facebook page and YouTube channel from our visual radio studio here at San Juan College. My guest this morning, Sandra Grunwaldt, is here from San Juan Regional Medical Center. She is the Diabetes Education Manager. Also, she is with Full Engagement Training, or F.E.T, at the hospital. And again, thank you for coming in this morning, and happy Thanksgiving.
Thank you very much, Scott. Happy Thanksgiving to you, too. This
Thank
is the
you.
start of the whole holiday season.
It really
officially.
is, and off we go. And we've just been talking about some of the parts of the holiday season that can be more challenging than others, to use your word. And that's what brings you in here this morning to talk a little bit about the Diabetes Education Program, because it is National Diabetes Awareness Month. And what got all this started? I guess, was it the need in the community? Because we seem to have a higher than average diabetes problem in San Juan County, I guess is the way to say it.
You have said it exactly correct. And I can share with you one of the great benefits of San Juan Regional Medical Center being a community-based, community-owned hospital is we do something called the Community Health Needs Assessment. And it is, in a nutshell, asking people what do they think, the key stakeholders in our community, what do they believe based on their experience, their interactions are the highest need medical issues in San Juan County.
Okay, right.
And time again, specifically even more so in 2014, and then just this past year we did the survey, diabetes is in the top 5 as one of the top 5 most important health challenges in our community. And that is one reason why the Diabetes Education Program began and why the National Diabetes Prevention Program is in effect. It is to address that need, because we listen to people that are coming to see us as our customers, and we want to have a healthy, vibrant community. And the doctors are busy, and the disease that diabetes is very, very complicated, because it affects the whole person. And it's a lifelong disease, and if people can learn how to manage it, they can have a better life. And you mentioned that the incidence is higher here in San Juan County, and you're exactly right. We have that about 14% of San Juan County adults report that they have diabetes. So that is not counting people that may have it, that have just not been diagnosed yet.
Okay. Does that include folks who are maybe
It does not.
diabetic either?
That's
Okay.
another about 8%.
I see.
And those are people that report that they have prediabetes. So if you look at the number of people that may not have seen their doctor in a while, they may not have had their labs drawn
Right.
in sometime, they may just not be aware.
So they could be walking around being a diabetic, I suppose, and not know.
That is not uncommon, Scott,
Yeah.
because there aren't significant, we say, symptoms
Right.
that are real obvious.
Right.
So
Until maybe it's too late, I suppose, if it progresses, I guess.
Sometimes. And that's why we say it's so important to have that relationship with your doctor.
Right. And again, as I mentioned, neither one of us are doctors. But
Correct. Thank you for clarifying.
But that's good that you're here, because you have a lot of experience talking about this and helping people through these programs. And if folks are just joining us, there is another program starting up in February that is free to the public.
Exactly. And that is our diabetes prevention program. That'll start in February. And then ongoing, we have a series of classes for people that have been diagnosed with diabetes. And the great thing about that is we have them at a couple of convenient locations. We're right now at the Bonnie Dallas Senior Center.
Okay.
And then we've also been at the Sycamore Center, and then we'll actually be at the college next year.
Nice.
So
Okay.
we're really going out to the community, trying to make it as convenient as possible for people to say, look, I've got this, or I'm concerned about getting this disease. What can I do either to prevent it or to manage it better?
Right.
And that's why I'm here, is to really encourage people to get the help that can really make their life so much more worthwhile if they feel better and can do the things they love.
Got it. Now, remind me again, I think I've heard this before, that if someone is diagnosed with maybe pre-diabetes or perhaps it is diabetes, that in some cases it can be reversed.
Well, diabetes itself cannot, according to the American Diabetes Association. But if you are at high risk or in that pre
Right.
area,
Yeah.
that can be you can prevent the onset of
Going
diabetes.
into full diabetes,
Exactly.
I guess, right?
Or significantly delay it.
Okay.
So we just want to make sure that message is clear. But
Right.
that's why we have the two different sets of educational opportunities for people, for those that are at high risk and those that have been already diagnosed by their doctor.
Okay.
And right now, actually, ongoing right this coming week is the next class for people that may have already been diagnosed with diabetes, or we also have those that are caregivers or spouses of someone that has diabetes, because sometimes
That's important.
it's very important, because sometimes the person that's doing the cooking for someone that has diabetes wants to be able to make good choices to support them and do the right thing, but they also need that knowledge.
Sure.
And they are more than welcome to come to the classes.
Okay.
And that's why we'll even have, caregivers at all levels that will come to the class with the person that already has been diagnosed.
Very important. And so again, if folks are listening, watching this morning and want more information, they can go to the
Yes.
website, sanjuanregional.com. They can call you.
Yes, 609-2171, and I'd be happy to help them, get them the right place, get the referral in order, let them know where to be for the class, and really start them on a whole new path of being their best.
Right. And you mentioned that this is an 8-month commitment, the class, when folks sign up in February, right? And start
Yes.
coming in February. So that would mean, if my math is correct, next month, December,
Yes.
you have a class that's wrapping up.
We do, actually. We're finishing,
Right.
we're graduating the class of the prevention program, which is wonderful,
And
really wonderful.
And I would imagine that they have a lot of great success stories,
Oh,
or
goodness.
the members of that class could really say some things about how their year started as opposed to how it's ending.
Definitely. And, we have, everyone does a, picture before and at the end, and they have a diet journal that we have them follow. We
Sure.
have activity charts that they track. So there's lots of really great successes that they can look back and say, oh, look at my journey. Look at where I was X number of months ago. Look where I am today. And it's really wonderful. We've had people that have lost significant amounts of weight, have lowered, A1Cs
Right.
or some of those significant numbers, and that's really, really the success stories that continue us on the journey of providing these wonderful classes and education opportunities.
Right. And for as long as you've been doing this, again, this is something that's hopefully sticks with these graduates, if you will, that they have
Exactly.
this new healthy habits, this healthy lifestyle that you've kind of
Correct.
instilled in them in this 8 months, that they've kind of been able to adopt this, and they don't necessarily fall off the wagon, for lack of a better term.
That is the goal. That is the goal. But the other really nice benefit of us and our consistency and our sustainability is people are always more than welcome to come back. And we've had
good.
graduates that, maybe they have a life-changing situation and there's some challenges and they feel they could use a little bit more support or
Okay.
some reminders. They're more than welcome to join us. So that's a wonderful positive. And
Right.
the same with the diabetes education classes. That's a series right now that's going on.
Right.
And that's a series of 6 weeks, and all topics from insulin management to managing your stress to carbohydrate counting. They can come to any one of those classes, and if they miss one, they can pick right up again next year. So
Okay. And this is a less formalized, I guess, set of classes, right? For folks then who are having challenges with diabetes. Is that
yes.
the way to put it?
I don't know if it's less formalized. It's more ongoing.
Okay.
Because
But it's not 8 months. It's
Correct.
much shorter.
It
period.
is 6 weeks.
6 weeks is what
And
you said.
so 6 Tuesdays in a row at the Bonnie Dallas Senior Center.
Okay. And again, still free to the public?
Yes, it is.
Okay.
There is no charge. There is no copay. And that is because we are a community-owned hospital.
Right. But folks do need to sign up.
Yes, we
And they
do.
would need to sign up through you or get a referral or whatever it is.
Yes, they can call me, the same 609-2171.
Okay.
And we just ask that they let us know they're coming so that we can have the right number of packets and snacks and those type of things. Be prepared for the right amount of people.
Sure.
So
Very good.
That's
All
it.
right. Excellent. And before we run out of time,
Yes.
because we are almost out of time, wouldn't
Goodness.
you know it, Sandy? But F.E.T, the
Yes.
full engagement training, what you and I have talked about
We
for
have.
a number of years. It keeps
Oh.
going strong, though, doesn't it?
It really does. And we actually in December have a wonderful community class from people all the way from Durango to Arizona that are coming. And really, out of respect for time and our primary topic, full engagement training is meant for anyone. Anyone that feels they could use a little bit more information on how to improve their energy, if you're looking for a little
Right.
bit more, how to manage your stress a little bit better, how can you make better choices around nutrition, and how do you get more movement in your day. So F.E.T. is kind of the basis for a lot of the things we do because we say it's the foundation of you. If you practice those good habits, you're your
Right.
best.
And this can be for anyone at any level of
Exactly.
health, I suppose, right? The other programs we were talking about were for folks who maybe were pre-diabetic or diabetic themselves, but this could
Exactly.
be someone who's perfectly healthy, very active, but they want more or they want to try to manage that better. This is for them too.
Exactly. And it really is because it addresses all levels, not just the physical, because Scott, as you know, even if someone is in really good shape, they can struggle maybe mentally with some things. In other words, their focus, or maybe they're stuck in a place they don't want to be and they need to manage some anger, some stress, some things a little bit more effectively. So F.E.T. really addresses all those areas of us. Physically, yes, that's our foundation, but also emotionally and mentally. And then we say ultimately, spiritually.
Right.
And that may or may not connect with people. It can be in a religious sense, certainly. But what we say is, if we can get all those things in a really good place, understand them, be educated by them, practice them, we are the type of people that get out of bed every morning and are passionate about what we do. We're inspired by the work we have, the people we love, the people we influence. And are you committed to what you're doing? So being that fully engaged person is not easy, but people who are fully engaged are healthier, happier, and more productive because they are practicing that solid foundation of the good things that are really needed for all of us.
Right. And this is another series of classes that are offered. And again, if folks want more information, they can contact you,
We'll
go
keep
to the
that
website.
same number, yes,
Right.
SanJuanRegional.com
That's it.
and the 609-2171. I'd be happy to help anyone with any of their needs, and particularly this time of year when the physical activity and the stress management and the nutrition are some of the first things that go when we've got a lot of pressure and a lot of things to get done. But at the same time, those are the things that help us most if we can really practice and understand how to manage them well.
Very true. Sandy Grunwaldt, we are out of time, I'm sorry to say, but thank you so much for coming in this morning.
Thank you. This is quite an honor, and I appreciate you letting us spread the word.
Well, it's always great to visit with you. You've such energy, it just kind of is infectious, so thank you.
And happy holiday.
Same to
and
you.
your audience.
Thank you very much. Happy Thanksgiving. Sandy Grunwaldt from San Juan Regional Medical Center, my guest here on KSJE. And I'll be back with more in just a moment. The time right now is coming up on 8:40.